All right. Hello, everyone. As you all probably know by now, my name is Scarlett Pedretti, and today I'm going to be giving my presentation on my key informant interviews and focus group. And the topic of those were nutrition education needs of low-risk elderly patients in extended care facilities, otherwise known as long-term care. So let's just move on to the agenda for today. So I'm going to briefly give you guys an introduction to the study, and that's going to be followed by the methodology for my key informant interview, as well as my focus group and just some of the similarity and differences with those. And then I'm going to go over the data analysis that I used for the key informant interviews and the focus group, as well as some of the similarities and differences between those, before moving on to some of the key findings and implications, as well as the implications and recommendations for future studies. And then I'll wrap that all up with a brief conclusion for you guys. So let's get started here with our introduction. So for my research, I chose the question of what are the nutrition education needs of low-risk elderly patients living in long-term care facilities, and how can these needs be effectively addressed? So in order to do this, I performed the assessment of social determinants of health. And for my key informant interview, I actually looked on a more broader scale at the socioeconomic factors, such as cultural preferences, any sort of underlying conditions, or other preferences that these individuals might have, as well as the physical environment. Because at least for me, I've worked at a lot of different facilities that have different kind of dining settings, communal settings, social settings that can really impact the nutritional status of these residents. So I chose those two for my key informant interview, but based off the responses that I got from some of my interviewees, I chose to kind of refine my social determinants of health moving forward with the focus group. And for that, I chose to just look at education and social support, since those were predominant themes brought up in my key informant interviews. So for both the key informant interviews as well as the target audience, or as well as the focus group, the target audience was the same. I was looking at professional caregivers, dietitians, nurses, and anybody that has experience working with this population, as well as extended care facilities in general, including like ones that I work at, which is why I included a picture here to the right, which is me and my entire dietary staff at our last staff appreciation week. I included this because it is a motivator for me and why I chose this research to study. I love what I do, and I've been doing it for a little bit over 2 years now. But I know that there's always ways to improve these residents' lives, especially as far as food and nutrition goes. So I was really interested in diving a little bit deeper into this to benefit them and overall well-being of my residents. So next, we're going to move on to the methodology of my key informant interviews specifically. These interviews included a corporate dietitian, a certified nursing assistant, and a hybrid dietitian, all of which were recruited from professional networks like LinkedIn and care facilities, such as the one I work at or ones that I've worked at in the past. So the process of these interviews, they were conducted via Zoom, and they lasted about 20 to 30 minutes each. And thematic analysis was used for data coding, focused specifically on dietary challenges, some of their meal preferences, as well as the educational impact. Some of the challenges that I experienced doing these key informant interviews was scheduling interviews at convenient times for participants. And based off some of the things I've heard from my classmates in general, it seems like this was an issue for everybody. We're all busy and have um, very hectic schedules. But aside from that, ensuring participant understanding and consent in a virtual setting, as well as managing data recording and storage securely was an issue for me. I'm not super familiar with, doing recorded interviews on Zoom and just ensuring that, the communication is there even if we can't see each other. So that was a little bit of a challenge for me when doing the interviews. And some of the ancillary processes that were used were transcription, data organization, and manual data coding. The modifications that I had to add to my interviews was just placing an emphasis on social support and education as a key determinant of health based on some of the participant insights that I gathered. And at the end of the day, some of the lessons I learned was the importance of flexibility in scheduling, clear communication as far as the study's purpose and procedures go, as well as ensuring data security and confidentiality throughout the entire process. And the methodology for the focus group is going to look similar, just with little differences. So the participants for my focus group were comprised of one certified nursing assistant or CNA, a dietitian, and one nurse. And they all have experience working in extended care facilities, either currently or in the past. This focus group was also on Zoom, lasted about 30 minutes as well. Some of the challenges with this one was kind of ensuring the active participation and engagement from all of my participants, as well as kind of managing the time effectively so that all the discussion points were covered, but nobody was not getting to talk enough or talking too much. And then just kind of addressing some of the technical issues that we had at the beginning of the meeting. And the same three ancillary processes were used for my focus group, the transcription, data organization, and manual data coding. And the modifications that I had to use for my focus group just involved kind of altering some of the questions um, to match the refined DOH that I had mentioned in the previous slide. And then the lessons learned with my focus group was just the importance of active listening, facilitating open discussions, and the value of diverse perspectives. So next here, we're just going to go over the data analysis of my key informant interview. So the figures that I decided to include for this one was the theme and thick description chart that we had to fill out. And I pretty much went through the transcription for this and, tried to identify just the two main themes and then work from there and identify sub themes and which I color coded here. I didn't really have any specific rhyme or reason to choosing the colors, but just made sure that they were different enough to kind of point out and branch under each one of these individual themes. So the two themes that I got from the key informant interviews was challenges in meeting dietary needs as well as strategies for enhancing nutritional care. So for the first theme, the codes were swallowing difficulties, aversions to certain foods, as well as medication-related appetite issues, while the second theme was comprised of personalized care plans, communal dining programs, and tailored nutrition education codes. And then the second diagram I have here on the right just kind of shows the frequency that the codes came up in my transcription process. And as you can see here, personalized care plans and tailored nutrition education were the most frequently used codes out of the transcription. And my focus group data analysis was similar. As far as the methods used, except the themes were a little bit different for this one because it was a little bit more refined after doing my key informant interviews. So the themes that I pulled from this was challenges in providing nutritional care, as well as the role of social support in nutritional well-being. So the codes for challenges in providing nutritional care were dietary restrictions, cultural preferences, and communication learning barriers, which also kind of fall under that socioeconomic social determinant of health I mentioned earlier. While the codes for the role of social support and nutritional well-being were community engagement, caregiver involvement, and staff education. And as you can see in this bar graph I have here on the left, caregiver involvement came up way more often than any of the other codes in this one, just to really, show how social support and the involvement of caregivers can go such a long way in the lives of the residents. So next here, I'm just going to discuss some of the key findings for my key informant interview and focus group. So from the key informant interview, strategies such as offering varied textures, flavors, and meal options were employed to address dietary challenges among residents. as well as personalized care plans and tailored nutrition educations, were successful in improving residents' overall well-being. As far as the focus group data analysis goes, the analysis revealed challenges in providing nutritional care, including difficulties in ensuring adherence to dietary restrictions, catering to diverse cultural preferences, and overcoming some complex communication barriers. And social support emerged as a significant factor in nutritional well being, with community programs, caregiver involvement, and staff education playing crucial roles. And overall, the findings highlight the importance of individualized approaches to nutritional care and the significant impact that social support and education can have on dietary outcomes. So, what are the implications and recommendations of these findings? The implications for practice policy and future research could include implementing personalized care plans, enhancing social support networks in long term care facilities, as well as recommending policies that include advocating for ongoing staff education as well as community engagement. Future research should also evaluate the effectiveness of personalized care and education programs. And as far as recommendations go, I would recommend developing tailored nutrition education programs for each and every resident, as well as strengthening community engagement and caregiver involvement on a consistent basis. And also advocating for policies that prioritize education and support for these elderly residents. And so, to conclude this presentation, the findings highlight the importance of personalized care plans, tailored nutrition education, and a supportive dining environment for our elderly residents. Implementing these strategies can improve the quality of care for low risk elderly patients in extended care facilities, and it also aligns with the social determinants of health theory, emphasizing the influence of social, economic, and environmental factors on health outcomes. These findings also contribute to the field of nutrition and health promotion by addressing the complex interplay of individual needs, caregiver involvement, and community support systems, while also providing insights for developing effective interventions and programs to improve the nutritional status and overall quality of life for elderly residents. And this is all I have for you guys today, so thank you for watching and let me know if you have any questions.